Welcome to today's COVID-19 Echo. Today is May the 7th. Um, we're happy that you all joined us today. And Emily, if you'll take it away with some housekeeping tips.
Good morning, everybody. I'm an evaluator here at USET, and so I shared a link for a survey for everybody to give us feedback on. You can also claim continuing medical and nursing education credits if you complete the survey and attend the clinic. We are being recorded. This will be available later today, I believe, on our USET page. And I would also like to invite everybody to go ahead and share your name and tribal citizenship affiliation or intertribal organization affiliation in the chat, including USET staff. We're trying to get a good gauge on how well these clinics are reaching everybody. And that is all I have.
Great, thank you so much. We have some great presentations today for you. We have Imani Ransby, who's going to be giving a overview of the epidemiology of the Nashville area. We have Dr. Harry Brown, who's going to give us a presentation, and Imani Ransby and Emily Bear are going to be giving a presentation on masking. So we can start with Imani Ransby for the epidemiology updates.
Thanks, Brian. I'm gonna go ahead and try and share my screen here. Alrighty, so hi everyone, and thanks for joining today. As Brian said, I'll be giving an update on COVID-19 epidemiology for the Nashville service area or USET region. And that will just consist of reviewing some of the data points that are currently featured in our weekly USET aggregate surveillance reports. Please note we do send these out every Wednesday to representatives of USET member tribal nations as well as our USET staff. And these reports primarily consist of information related to COVID-19 testing and vaccine administration. I also wanted to take the time to just mention again that several weeks ago, you may have noticed the reports may have looked a bit different, the vaccine portion of the report specifically, as we are no longer displaying some of the tribal level specific data points you were once getting. Subsequently, aggregate level vaccination data pertaining to USET member tribal nations is also missing. So we were previously receiving this information from the Nashville area office through weekly reports from sites, but because they have now transitioned to using the IHS COVID-19 dashboard to collect and track that information, we no longer have direct access to it. And so permission and approval will be needed in order to restore that. We've tried to make this data request process as easy as possible and have just been simply asking that in your email reply on the weekly reports email that you indicate yes, along with whether you would like the USET tech to have access to just vaccination data or both vaccination and COVID-19 case surveillance data. So for those that have already replied granting approval, thank you. We should be able to get access to your respective dashboards and restore the information that was previously taken out within a week's time, as it takes a couple of days or so to get the data once that request is approved. So on the current slide, you'll see the number of new positive test results, the cumulative total of positive test results, as well as a 7-day positivity rate for the past week of April 27th to May 4th. We've seen an uptake or increase in all of these numbers since our last echo session, kind of further indicating that more transmission has been occurring in recent times and cases appear to be on the rise again, as we may be experiencing another wave perhaps. In particular, I'd like to make note of the percent positivity, as this has continued to be widely used as an indicator for how areas are being impacted by the pandemic. And it provides a good picture of the amount of COVID-19 cases that are kind of being seen overall. So on our last echo from April 23rd, the percent positivity rate was around 4.5%, whereas this week's was around 5.9, or if you want to say 6%. So again, from this, and even more apparent on the next slide, you'll notice that we are seeing a rise in the number of COVID-19 cases within the USET region as a whole. So this slide featured shows you the number of new positive COVID-19 test results from week to week over a 12-week period. As I mentioned before, for the current week of April 27th to May 4th, the number of new positives in our USET region was 53. As you can see, this was an increase from the past several weeks. And we can now see that it looks like a gradual increase has been occurring from week to week since the beginning of April, it looks like. So the amount of cases being reported is climbing. With the increases we are seeing, I want to note that it is still very vital that we continue with public health prevention measures and strategies that are used to really control the spread of COVID-19, such as our 3 Ws. So the graph displayed gives you the rate of new COVID-19 cases per 10,000. This is by USET counties, USET states, and the United States. We've also given a 12-week time frame for this information. Please note that this data was specifically obtained from CDC and state health departments, so it is not limited specifically to tribal citizens. We find this information useful as it's been a pretty good indicator for what's happening in and around the USET region in regards to the number or amount of COVID-19 cases that we are seeing locally and then at a state and national level. Due to data cleaning for the current week of April 27th to May 4th, the PERCTA, or Purchased and Referred Care Delivery Area, or USET county rate, and the USET state rates have been removed. So those are not available for the current week. Although the US rate for this week was reported as 10.46 cases per 10,000. And this was a slight decrease from what we saw the previous week. So the next few slides include some graphs for the vaccination data that is shown in our weekly surveillance reports. The slide featured shows you the percentage of population fully vaccinated, and that's broken down by the United States and Indian Health Service, or IHS. As I mentioned at the beginning, we have not included the data point for reporting facilities in the Nashville area, as that information is not available at this time to report on. Please note that these graphs are displaying numbers from the previous week of April 28th, as well as for the current report week of May 5th. And the United States and IHS percentages were derived from data retrieved from CDC's COVID-19 data tracker site. So for this past week, the United States percentage of population fully vaccinated was at 32%, whereas the Indian Health Service was at 26.6%. From this, you can really see that there's been continued progress made with vaccine administration nationally, as well as within the Indian Health Service area as a whole. So the following graph showcases the percentage of population fully vaccinated again, but instead here we're looking at it broken down by all USET states and the United States. Again, please note that the bar for reporting facilities in the Nashville area is missing from this as well. Information from the previous week has also been provided for this graph, so you can kind of see the percent increase that has occurred from week to week. So percentages for individual USET states appear to range from 23 to 42% for this current week, with 1 to 4% increases seen from the previous week here. And I think this graph also really shows again the progress being made with conducting vaccinations, particularly in USET states. And it's also exciting to see that some states are getting relatively close to that 50% mark, indicating that 50% of the population have been fully vaccinated for COVID-19. This last slide gives you the percentage of delivered COVID-19 vaccination doses that have been administered. And the information for this visual is broken down by United States, USET states combined, and lastly, individual USET states. As a reminder, again, you'll note that the reporting facilities in Nashville area bar has been omitted. To me, these percentages really show that a great job is being done in getting the vaccine that has been delivered to states administered to the public. I mentioned this on our last echo, and it appears to be the case again that USET states um, are really doing well with getting vaccines into people's arms. And so I'll just close by saying that if you do require any assistance, COVID-19 related or non-COVID-19 related, please feel free to contact us at usetinc.org, and we'd be happy to assist you. I'll take any questions now in this regard, if anyone has any.
Okay, not hearing any questions for Imani. We can move on to Dr. Brown's presentation. Taloa, can you pull up Dr. Brown's presentation, please?
Good morning. Can you hear me okay? Sound coming through okay? All right. So I'm going to talk this morning about the pause that happened with the Janssen or Johnson & Johnson COVID-19 vaccine back in April, and then what the CDC recommendations are after that. So this is in the interest of being able to give counsel to the people that we serve. So what are my objectives for today, the 423rd day of the pandemic? Again, I'd just like for you to become familiar with the rare but serious side effect known as thrombosis with thrombocytopenia syndrome with the Janssen vaccine, and then to be able to adequately counsel patients on the risks and benefits of receiving the Janssen vaccines. I don't have any disclosures or conflicts of interest to report. Next slide, please. But before I go into the vaccine itself, I just wanted to talk for a minute about some good news. You know, what good is going on now that we're 14 months into this COVID era? Well, some of the good news is we have 3 effective vaccines in the United States for COVID-19. Cases are going down overall in the United States, as Imani just showed us. The United States has administered over 250 million doses of vaccine. It's 250 million. That's a lot of vaccine. 32% of the total overall population is now fully vaccinated. That is, they've either received 2 doses of one of the mRNA vaccines or 1 dose of the Janssen. 41% of the population 18 and over is fully vaccinated. And the really good news, the high risk group, those at highest risk of bad outcomes from COVID-19, the 65-year-old plus population, 70% of them are fully vaccinated and over 80% have received at least 1 vaccine. And then last but not least, there will soon be a vaccine for, or maybe 2 vaccines for the 12 to 17-year-old age group. I know I've said this before, but I expect almost any day now that the Pfizer-BioNTech vaccine will be approved for 12 to 15-year-olds. It's already approved for those 16 and over. I expect Moderna will be not too far behind. They're currently approved for 18 and over, but they've done a clinical trial in 12 to 17-year-olds that we should be hearing about very soon. Next slide, please. So just to kind of quickly review, the Janssen vaccine, otherwise and probably more commonly known as the Johnson and Johnson vaccine, is a non-replicating viral vectored vaccine. It uses adenovirus type 26 to take the genetic code into your cell to get your cell to produce the spike protein of the SARS-CoV-2 virus so that your immune system can then mount an immune response. And if you're ever exposed to the actual virus, your immune system can take care of it. It's about 66% effective at preventing all symptomatic disease and 85% effective at preventing severe disease. It's highly effective at preventing hospitalization and death. In the phase 3 trial, it was almost 100% effective at preventing hospitalization and pretty much 100% at preventing death from COVID. Two huge advantages of this vaccine. One is it only requires a single dose to achieve this level of protection. And then the other real advantage that it has over the mRNA vaccines is it doesn't require that deep freeze kind of storage. You can just store it in the refrigerator. Next slide, please. So let's talk about the pause that happened back in April. On February 27th, an emergency use authorization was granted by the FDA for the Janssen COVID-19 vaccine in individuals 18 and older. About 6 weeks after the emergency use authorization on April 13th, the CDC and FDA jointly recommended that the vaccine administration be halted after they received 6 cases of this really serious side effect, or at least it was thought to be a side effect of the vaccine. That is cerebral venous sinus thrombosis with thrombocytopenia. And I'll talk more about that syndrome in a minute. So over the next 10 days, 2 emergency meetings were held of the Advisory Committee on Immunization Practices at the CDC. They reviewed the safety concerns, and then on the 23rd of April, they decided that they would issue a recommendation to go ahead and start using it in all age groups, along with a warning, though, that there were rare clotting events that might occur within 3 weeks of vaccination, especially in younger women, that is, women under age 50. Next slide, please. So what was the serious side effect? Let's dive a little deeper into that. CVST, or cerebral venous sinus thrombosis, is a condition where clots form in the large veins that drain the brain. Thrombocytopenia, most of you probably know, just means a low platelet count. Platelets are the little cells in our blood that help our blood to clot. And then TTS, which is what this syndrome is now being called, is thrombosis with thrombocytopenia syndrome. Boy, that's a little bit of a tongue twister. This seems like an oxymoron, because generally, if a patient has thrombocytopenia, that is a low platelet count, rather than form clots, they bleed, because platelets help us to form clots. So if you don't have enough platelets, you generally don't form clots. But in this condition, you actually do form clots, despite a low platelet count. And I'll get into the reason for that in just a minute. It's also being called VITT, although this term seems to be a little out of favor now. Instead, they're using TTS, but this is vaccine-induced immune thrombosis with thrombocytopenia. VAERS, or VAERS, is the Vaccine Adverse Event Reporting System. And that's how we found out about this. These 6 cases were reported to VAERS, and that triggered an alert at the CDC that, something was going on, needed to be looked into. And I really think that this whole episode is quite reassuring in a way, that the system actually works. The safety system that we have in place picked up these extremely rare events. And how rare were they? Well, we'll get into that in a minute too. Next slide, please. This is just a picture of the large veins that take blood away from the brain and back to the heart. And these are the veins that the blood clots were forming in. Next slide, please. So let's talk about TTS and the Janssen vaccine. So if we go back to last fall, when they were conducting the phase 3 trial of this vaccine, there were actually 2 cases of cerebral venous sinus thrombosis that occurred during the trial. One occurred in somebody that had received placebo, and one occurred in somebody that received the vaccine. This event actually caused a pause in the phase 3 trial that went on for a while. I think it was a couple of weeks. And in the end, they decided that the person that had received the vaccine, that was a 25-year-old male, they decided that it wasn't related to the vaccine, that there were other reasons that he may have had this. Now, in retrospect, it looks like maybe it probably was caused by the vaccine. From March 2nd to April 21st, there were almost 8 million doses of vaccine, the Janssen vaccine, given in the US. And in all, a total of 15 cases of TTS were reported. Most of these occurred in younger women in the 18 to 49-year-old age group. 13 of 15 were. There were 2 women over 50, but the oldest was 59. 12 out of the 15 had this cerebral venous sinus thrombosis with thrombocytopenia. The other 3 had clots in other places, chiefly the veins that drain the abdomen. 3 of the 15 died, so it's a pretty serious complication. The highest rate occurred in the 30 to 39-year-old age group, but it's hard to make a lot of this because it's such a small number that it's hard to know whether it's really that's the precise rate. So anyway, next slide, please. So symptom onset usually, in all these cases, it occurred somewhere between 6 and 15 days. The median time was 8 days after vaccination. None of these women were pregnant or within 12 weeks of delivery, which pregnancy and being in the immediate postpartum period raises the risk for blood clots. Now, a number of them did have some risk factors for clotting. About half had obesity, 2 were taking birth control pills, 2 had low thyroid, and 2 had high blood pressure. How much this is related to the syndrome at this point is unknown, again, because the numbers are so small, it's hard to make, great determinations about it. Next slide, please. So during the pause, after the CDC collected all the reports that were in VAERS up until the 21st of April, they had 6 reports initially. A few more reports came in during that time, but they did a risk-benefit analysis. And what they determined in doing this, after doing a lot of math, if they resume vaccination in all age groups, that is, everybody 18 and above, over a 6-month period, vaccination would prevent somewhere between about 4,000 and a little over 9,000 hospitalizations from COVID, about 1,000 to 2,200 ICU admissions, and somewhere between 586 and 1,435 deaths from COVID. Now, you would expect at the rate of vaccination that they used in the modeling that there would be 26 cases of TTP. So the risk-benefit analysis there would be, preventing on the low end 586 deaths as opposed to 26 cases of this thrombosis with thrombocytopenia syndrome. That should be TTS, not TTP. So the risk-benefit ratio there looks to favor the benefit of giving the vaccine. They also did an analysis if they didn't give it to women, or actually I think it was anybody under the age of 50, they would prevent far fewer deaths, and they would also prevent a lot more cases of TTS. That should be TTS again, not TTP. But there would only be 2 cases if they did it in 50 and over. Next slide, please. So let's talk just for a minute about the clinical features. So this syndrome involves blood clots, especially in the cerebral veins. Nobody knows why. It has a propensity to that site, but apparently it does. The abdominal veins are the second most common place for it. The symptoms are headache, which you might expect if you had a big blood clot in your head, back pain, abdominal pain, nausea, vomiting, and neurologic symptoms like weakness, slurred speech, visual disturbances, seizures. There are cases of clots in the legs as well, so you might get leg pain from that. And then if these clots then go to the lungs, you'd get short of breath. Thrombocytopenia, or a low platelet count, in some situations, very low platelet counts are part of the syndrome. Now, one of the other adenovirus vaccines, the AstraZeneca vaccine, that one's not being used in the US, but it's been used extensively in Europe, and they've seen a very similar syndrome with that. And that seems to cause somewhere around 1 out of 250,000 doses, they see this similar syndrome. The problem seems to be, and the reason that despite a low platelet count, you get blood clots forming, is an antibody against something called platelet factor 4, which is a protein found on platelets. This antibody causes the platelets to become activated, just like they do in a situation where you need to clot, like if you get a big cut or something. And so the platelets get activated. And the reason that you get a low platelet count is because these platelets have antibodies on them, and your spleen recognizes that as something wrong with those platelets, and it takes them out of circulation. So at the same time that the platelets are activated and start causing clots, the spleen starts taking them out of circulation, which is what leads to the low platelet count. This whole syndrome is very similar to something that we've seen for a long time in clinical medicine, that is something called heparin-induced thrombocytopenia, which is also caused by an antibody to platelet factor 4. What the actual cause is with these vaccines is unknown at this time. There's some speculation that it may be the adenoviral vector. However, the AstraZeneca uses a different adenovirus. They use a chimpanzee adenovirus. And this problem was not reported with another very similar vaccine made by Janssen for Ebola. They haven't had any reported cases of this. There are 2 other adenoviral vectored vaccines being used around the world. One is the Russian vaccine made by the Gamaleya Institute. The other is a Chinese vaccine made by CanSino. And as far as we know, there are no reported cases with those vaccines either. So this is all still a bit of a mystery. Hopefully there'll be much more to come in the future about the cause so that we can possibly do something to prevent it. Next slide, please. So what's the bottom line here? So there's a rare but serious side effect that can occur in people that get the Janssen COVID vaccine. The overall risk is so far in the US has been about 2 per million, but it may be much higher, maybe as high as 12 per million in younger women. So patients should be counseled before vaccination. Well, obviously all patients should be counseled before they receive a vaccine, but particularly they should be told that there is this rare but serious side effect that's been reported mostly in women under 50. And there have been no cases of this TTS that have been associated with the 2 other vaccines that we're using, the mRNA vaccines that are made by Moderna and Pfizer. Patients and healthcare personnel should be aware of the symptoms of TTS after vaccination. And if people have any of these symptoms, they need to report it to their provider and have a platelet count done, as well as a platelet factor 4 ELISA test. And if they come back with low platelets, then they probably need to be put in the ICU and be cared for by a hematologist. So that's the end of my presentation, I think. I'll take questions. These are just a couple of references, the CDC's updated recommendation and the updated fact sheet for providers and patients you can find there. So if there are any questions, I'd be happy to take those now.
Thank you for a wonderful presentation, Dr. Brown. Do we have any questions at this time for Dr. Brown? You can type them into the chat or you can unmute yourself and ask, either way. Just a reminder to fill out the survey that's in the chat and put your name and travel affiliation in the chat box as well for those that have joined later. And if there's no questions, we can move on to Amani Ransby's presentation and Emily Bear's presentation on masking.
Thanks, Brian. Let me share my screen.
Thanks, Brian. Thank you, Amani, for pulling that up.
No problem.
So good day, everyone. Hi, we're hopefully going to be delivering a little bit of positive news here with recommendations for masking in fully vaccinated individuals. So just going over CDC's latest guidance and revised recommendations. I am going to be going over the masking recommendations portion. And Imani will be providing more of an in-depth look into recommendations for fully vaccinated individuals. Next slide. So you may have seen this around. The CDC has issued this visual guide for mask use. And I know it's kind of been the cause of some confusion. So I will say that it has been the cause of some confusion for me as well. I think it could have been laid out a little bit more clearly, but hopefully going over it today will help. So I just wanted to give a brief guide to how they laid it out, which is in terms of risk. So green is denoting the least risk or the safest activities, and yellow is less safe, red is the least safe. And they have presented this as unvaccinated people versus fully vaccinated people, so those 2 groups. And then they have presented a list of activities broken down by outdoor and indoor spaces. So This is by no means exhaustive. They have just given some specific examples in this list, but it is a pretty helpful guide once you take the time to decipher it. So right here, you can see that the outdoor activities are presented, and for the most part, fully vaccinated people are no longer recommended to wear masks, and we will get into that a little bit more later on. So next slide. So for indoors mask use, I specifically wanted to go over this because there is some ambiguity about the way this is presented alongside some of the new guidance for fully vaccinated individuals, particularly in regard to situation number 4, where you can see it says attending a small indoor gathering of fully vaccinated and unvaccinated people. Now, the CDC had previously issued a recommendation that fully vaccinated people would not need to be wearing masks when visiting with other vaccinated or unvaccinated friends, but the actual guidance, which would seem to contrast this situation, the actual guidance is that fully vaccinated people can visit other vaccinated people indoors. They can also visit completely unvaccinated people, including children, but from a single household. So you can see here that this is talking about multiple households. So in this case, they're saying you really should still be working to minimize exposure, regardless of your or your friends and family's vaccination status. The rest of the activities here are fairly self-explanatory, and they just advise still following those masking precautions in crowded indoor places, even if you are vaccinated. Next slide. And I wanted to put this up here as the definition of vaccinated versus unvaccinated individuals. The CDC considers individuals fully vaccinated for COVID-19 at the point of 2 weeks or greater after they received the second dose in a 2-dose series. So those are the mRNA vaccines that Dr. Brown just mentioned, so Pfizer, BioNTech, or Moderna, or 2 weeks or greater after they receive a single-dose vaccine. So that's the Janssen, or however you know that vaccine. And I wanted to put that up there because I'm aware that the vaccine manufacturers themselves will say, for example, their timeline for Pfizer BioNTech does say immunity is reached 1 week after your second dose, but that is not the CDC's actual definition of fully vaccinated. So that's an important distinction to consider when you take this guidance into consideration. Next slide. So let's get into the major changes. These are hopefully a little bit positive, especially this travel guidance change. So it's quite a big change actually, because previously the CDC did recommend a negative test for everyone, either 1 to 3 days prior to traveling, and a negative test after you return, so 3 to 5 days while you quarantine for a week to 10 days. But they actually did a very in-depth study into the benefit of this, and they found that fully vaccinated individuals, when they adhere to these measures, didn't actually see much reduction in risk. So any of these guidance, any of these measures, or a combination of these measures didn't really have a huge impact. So they actually decided recently that you can refrain from all of these testing requirements, and you're also not required to self-quarantine following travel. That's kind of a positive. Like 14 months into this pandemic, I think it's nice to have that to look forward to, especially with the summer coming up and everything. So I did want to put this one note on here too, since we're talking about masking, as a reminder that masking is still required when you're traveling. So you may not have to go through all the testing, but if you're taking an airplane, you're still going to have to wear a mask in the airplane, in the airport, etc. So just keeping that in mind. Next slide. And then the other guidance, like we were talking about earlier, so guidance for gatherings and for outdoor activities. Previously, we were recommended to wear masks at all outdoor gatherings and activities that involved multiple households or other people who weren't especially part of your like little bubble. So some states also did implement like public space mask mandates as well. So just anywhere you were outside, you were required to wear a mask, especially in the Northeast. So the big updated change here is that the CDC has said that now both unvaccinated and fully vaccinated individuals no longer need to wear masks outdoors when they're exercising or when they're attending small gatherings. So this is due to the lower level of transmission currently, and currently the lower level of transmission, as well as the increase in fully vaccinated individuals. But just keeping in mind that they do say small outdoor gatherings, so maybe not barbecues, like big barbecues yet, but we'll see. So next slide. And what hasn't changed? To answer that question, the short answer is quite a lot. You still really should be taking precautions indoors, whether you're vaccinated or fully vaccinated, if you're going to attend events or activities that do involve either like a lot of exertion, so like going to the gym or something, and crowded spaces. And then as well, you should still be taking precautions to minimize your exposure, regardless of your vaccination status, if you're attending larger outdoor gatherings. Next slide. And my final remarks are just that it's good to remember that this guidance is being regularly reviewed and updated. So these might not seem like a lot of changes right now, but that could change quickly in the future. Hopefully some things will be phased out in the future as we understand more about the risks of certain activities, so their level of risk to us, and as the danger in the population kind of is minimized as more people become fully vaccinated, more precautions are going to be phased out. So that's a little bit of optimism, although we don't know the time frame for that yet. And then just remember, as you do follow these new recommendations, that the guidance from the CDC is not homogeneous. So every state or tribal nation, or even smaller municipalities like your county government, can implement different guidance as they see fit. So if you're traveling, just be aware of the specific precautions in those areas, since they might be different from where you're coming from. And that is it for masking recommendations. So I'm going to hand it over to Imani to talking about fully vaccinated people.
Hi again, everyone, and thank you, Emily, for that great presentation on masking. So as she just said, we are now going to transition a bit to discussing some updates on for recommendations for fully vaccinated individuals. So herd immunity, community immunity, and population immunity are actually pretty synonymous, but I think we are mostly all familiar with hearing herd immunity, at least I am. And herd immunity, I think, can best be described as when enough people in a certain population have received immunity to the point where disease transmission is slowed and the number of infections occurring decreases greatly. People can acquire immunity either through contracting the virus or pathogen of concern, or they can through receiving a vaccination. As far as herd immunity thresholds goes, or the percentage of the population fully immune needed to reach herd immunity, that often ranges between 50 and 90%. But I do want to note that there is no exact magic number per se, as the threshold needed could change. Having a certain level of herd immunity may not be the end all, as there may still be some spread or cases that occur, but it is not expected that the amount will be similar to that of a widespread epidemic or pandemic per se. So that being said, we still, again, cannot abandon public health strategies used against COVID-19 despite meeting herd immunity, I would say. And the figure on the right really depicts herd immunity quite well to me, where you see where you see no herd immunity is present, you're seeing more transmission occur, more infections, and then where herd immunity has been achieved, you can clearly see that the virus cannot really spread as easily. And in general, I want to say that vaccinating for COVID-19 has a lot of great benefits, specifically in minimizing severe illness and deaths attributed to the virus, and also providing protection to those with weakened immune systems or those unable to get vaccinated. So this is why getting as many people vaccinated as possible is important to do. I wanted to quickly speak on COVID-19 immunity and vaccine effectiveness while on the current slide. The main takeaway for vaccine effectiveness that I wanted to get across is that all 3 COVID-19 vaccines that are currently available to everyone in the United States have proven to be effective in preventing COVID-19. As most are already familiar, these COVID-19 vaccines are specifically Pfizer, Moderna, and the Johnson and Johnson. And based on literature, the COVID-19 vaccines have shown to be 95, 94, and 72% effective at preventing COVID-19 respectively. Being fully vaccinated, as Emily mentioned, denotes having received 2 doses of Pfizer or Moderna or a single dose of the Johnson & Johnson 2 weeks or 14 days following your final shot. Again, that is CDC's definition of fully vaccinated, as we mentioned. Until you have become fully vaccinated, it's really still important to continue following the guidance provided for unvaccinated individuals in an effort to protect yourself and others. I also want to note that having been fully vaccinated, I also want to note that those that have been fully vaccinated but are taking medication that weakens your immune system may need to follow recommendations for non-vaccinated individuals, as this could have an impact on their immunity. So speaking with your clinician or physician about that is the guidance provided by CDC as well for those that may potentially have weakened immune systems due to medications they are taking. I also want to note that no vaccine is 100% effective per se, so it's still possible to get sick, although getting vaccinated does greatly decrease your chance of illness resulting in a hospitalization or death. And lastly, as far as variants go, this is still being studied, although COVID-19 vaccines may be effective against some of them. And speaking on COVID-19 immunity specifically, I've heard herd immunity thresholds of 70 to 80% referenced, but there is still some uncertainty about this. And as mentioned before, these numbers could change depending on how the pandemic kind of plays out. So what should you do if you have been fully vaccinated? I would say first know and understand that you can now partake in many activities that you couldn't as an unvaccinated person, but also note that continuing to make an effort to protect yourself and others is still really needed to help alleviate the impact COVID-19 has on public health. So when trying to determine whether or not to partake in a certain activity, I really would consider the following. Checking the status of COVID-19 infections in your area, asking how many people are involved in this activity, and where the activity will take place, whether that's outdoors or indoors. So for example, if I'm thinking about attending a family birthday party and the family gathering is occurring outside, but all partygoers are fully vaccinated, then I would say that's a pretty safe choice versus maybe debating about going to an indoor family gathering where all the partygoers are unvaccinated and the space is crowded. And always, just as a precaution, continue to wash your hands frequently and wear your mask when it is applicable. Emily also kind of spoke on the indoor versus outdoor activities a bit. So I'm just going to speak a little bit more on that. CDC does state that outdoor activities are generally safer than the indoor activities, but again, this could change based on a variety of factors. It appears that social distancing is not really referenced for fully vaccinated, although masking is still a precaution that's widely used. A few things to note about indoor and outdoor activities. For indoor activities, fully vaccinated people can have indoor gatherings with other fully vaccinated people without social distancing in place or masking. They can also gather indoors with unvaccinated people of any age from one other household. And it's recommended, again, to avoid large indoor gatherings and areas with poor ventilation if you are doing an indoor activity. As for outdoor activities, you can participate in outdoor activities and recreation without a mask unless it's a crowded area or venue. And again, outdoor activities have been described as relatively minimal risk for those that are fully vaccinated. In the case scenario where outdoor activities may become less safe, that may be where community transmission is occurring, maybe at a moderate to high level, or activities involving behaviors like singing, shouting, physical exertion, or heavy breathing are present, then that may become a less safe situation if you are outdoors. Moving on to traveling and potential COVID-19 exposures. Traveling in particular is something that really excites me now being fully vaccinated, as I really love to travel. But some things to note are for domestic travel in the US, getting tested before or after travel or self-quarantining after travel is not needed. If you are traveling internationally, then it's a good idea to check with the destination regarding testing, vaccination, and quarantine recommendations or regulations, as they may differ from the United States. So be sure to research that and stay up to date. In addition, no testing is needed in order to leave the United States, although a negative COVID-19 test upon returning to the US from an international destination is needed. And testing should also still be done 3 to 5 days after any international travel. Self-quarantine specifically is not required after arriving in the US, but when talking about potential COVID-19 exposures for those fully vaccinated, the guidance is if you have been in contact with someone that has COVID-19, there's no need to stay away from others or get tested unless you start having symptoms. But if you are in a living situation where you are in constant contact with those that have COVID-19, testing may be recommended regardless of whether or not symptoms are present. If you do test positive for COVID-19, then regardless of your vaccination status, you should not visit or attend a gathering or visit public settings. And it's still important that those that are fully vaccinated still watch out for potential symptoms of COVID-19, especially following an exposure to someone who may be a suspected or confirmed COVID-19 case. And if symptoms do develop, all people, regardless of vaccination status, should isolate and see a clinician regarding their symptoms and potential exposure to the virus. Just some closing remarks. We all know that vaccinating is one of the prime ways we can combat COVID-19, as COVID-19 vaccines have proven to be very effective at reducing severe illness, preventing hospitalizations and even death compared to no vaccine at all. So I'd really just like to encourage everyone again to get vaccinated if you are able to do so. But again, other measures such as our 3Ws are still very helpful at this time. So they should be continued by everyone when applicable. And this last slide, it just gives you a couple of resources and links to the CDC website where you can take a closer look at the guidance that we've reviewed or covered today. And I think we'll take any questions now if there are any.
Yes, if you have any questions, you can type them into the chat or unmute yourself and ask your question. Thank you again for a wonderful presentation, Imani and Emily. So do we have any questions at this time? I found it very uplifting that we can gather outside now if we're fully vaccinated. That's wonderful.
Yes, I'm really excited about that too.
Hearing no questions, we can go ahead and end this session for today. Just a reminder to fill out the survey that is in the chat. It'll give us some good feedback. Yes, have a good weekend. Thank you all.